Welcome to the Dental Marketing Podcast, a podcast that helps dentists win in the online world of modern-day marketing. Each week, we cover the most cutting-edge marketing tactics and strategies that are working right now across our client base to drive leads, phone calls, and more new patients for dentists. Now, here's your host and founder of Kickstart Dental Marketing, Chris Pistorius.
Hey everyone, welcome to the No BS Dental Marketing Podcast. I'm your host, Chris Pistorius, and on this show, as you know, we talk about straight to the point, no BS tactics, tricks, and strategies to help you grow your practice. Now, there's no fluff here, just great information that you can start using today to increase your bottom line. So if you're a dental practice owner, a manager, a front desk professional, or whatever, be sure to click the subscribe button on this page so that you can keep up with all the tips and tricks. Now, today we're talking with a very special guest, Mr. Dr. Todd Engel of the Engel Institute in Charlotte, North Carolina. Now, Dr. Engel is well known in dentistry. You've probably heard of him most likely, but he's one of the top authorities, in my opinion anyway, in dental implant rehabilitation, CT-guided surgical design, complex treatment planning, and full mouth rehabilitations. He also has hosted live radio. He's authored several articles and has been a featured speaker both nationally and internationally on the topic of dental implants. Now, Dr. Engel stays very busy. Not only does he run this top of the line, best in America dental implant training school for dentists, but he also has a thriving private practice called the Engel Dental Center, also in Charlotte, North Carolina. So, Dr. Engel, thanks so much for being with us today.
Thanks for having me.
Sure, no problem. So, hey, tell me, when you were 5, 6 years old, were you just thinking in the back of your mind, I want to be a dentist?
No.
How did you get started in this crazy industry?
Yeah, so the definitive answer is no. I wanted to play baseball and do all those things that little guys want to do when they're 5 and 6. The career moves have changed a couple times. Actually, when I was a young teenager, 12, 13 years old, the hobby was drumming, and a few years later I became more involved, and by the time I was in my late teens I became a professional where I was actually getting paid to play, and that kind of stayed with me until my mid-20s, and that's what I did, and that's what I love to do, and actually still do a little bit now. But when I became a parent, when I became a dad of a daughter, our first daughter, I decided that I had to go back and do something that was more stable and more local, kept me at home, and I just went for the big thing. I wanted to be a doctor. I love the idea about being intelligent, and I wanted to learn how to be intelligent and take care of people. And oddly enough, I wasn't even sure about what that meant. I didn't know what branch I wanted to be involved in. I didn't have parents that were doctors or grandparents or uncles or aunts. So I just went back to school a little bit later than most. And as I was kind of going through the undergrad stuff, realizing all of the commitment that it would take, I was ready. And I think for me, it worked because as a young adult versus coming out at 18 or 19, I was more prepared for the struggle and the fight of it. And so I got through all the normal biology stuff and decided that I wanted to be a doctor. And I think the defining moment was I always thought that I would want to be someone who would want to deliver babies. And when I looked more into being an obstetrician, I loved the good stuff, but I didn't love the bad stuff, and I didn't know that my heart could take that. So oddly enough, at the same time, I had a relative that was involved in a very, very bad car accident, survived it, thankfully, but had his whole face rebuilt with metal, especially intraorally, and I was so fascinated with it, and you couldn't even tell. And so I was like, wow, maybe I could do something like that. But I never thought it would be to this extent. I never at that point thought I'd be teaching it. But yeah, so that's when kind of the passion of, wow, that's how you help people kind of hit me.
Yeah, that's incredible. So I'd heard you talk before that you were a drummer. What kind of music? What tempo do you like?
Well, for me, I mean, what I listen to and what I like to play are probably different. I don't know.
Really?
People say that you ask them, what kind of music you like? And they go, oh, all kinds of music. And then you start, well, you like jazz? No. You like this? No. You like that? No. So for me, in the drumming part of it, it was always fun when I got to play the upbeat, dancey, poppy stuff, right? The old Motown stuff, the Michael Jackson stuff, the Thriller stuff, and you see people dancing and having fun. And I've always been a showman, man. You know, I just get up there and play and hit hard and keep people's butt moving and feet moving, and it's awesome. But I certainly have a respect for a lot of others too. You know, my favorite band, I think I'd have to say, is Queen. But
nice.
That's kind of the drumming era.
Yeah, that's awesome. And so you go from this drummer. Did you ever really think about doing that professionally? Were you know?
Yeah, totally.
Oh, okay, gotcha.
100%. I grew up, you know, growing up, I was always a pretty decent athlete, but I never had size, right? So I always could throw a football, I always could throw a baseball, and meaning well, and I always ended up playing, you know, shortstop and quarterback when I was a kid. But I never became that 6'3" guy.
Yeah.
You know? And so ultimately, age kind of blocks you out from being a professional athlete, and I think a little bit of common sense too does, right? But I picked up this drumming thing, and I think the association between that and dental, it's just seeing people looking at you with a smile. Right? So whatever stage you're on, if you can make someone smile, or you can inspire them to look at you, and you know that you're part of their happiness, that's a gift, you know, and it's a gift that I really enjoyed, even to this day.
That's a great analogy of, you know, people smiling back at you. That's, if you can be in a profession like that happens all the time, you're probably doing pretty well.
Yeah, it was great. And you know, the two professions for me are so similar.
Yeah.
And, you know, when you know that you have a passion for it and you love to do it, people can see that and they can feel it, and they get connected, right? The vibe is there. They like being around you, and you like being around them. And
right.
It's fun, even if it's for a short time, like a 3-hour show or a 2-hour office visit, whatever. It's fun. Yeah.
So that's all right. So you get out of the drummer phase. You're going to be a doctor. You're going to be a dentist. Let's switch over to this implant stuff. How do you? At what point did you realize that, hey, this implant stuff's cool, I want to do this? And then not only do I want to do this, but I want to get so good at it that I'm going to teach tons of other doctors on how to do it as well.
Yeah. You know, it has been a personal marriage to my profession for 25 years, right? So my institute is going on its 19th year.
Wow.
Yeah. And so to sum it up in a few minutes is nearly impossible.
Yeah.
But what I would say is this, that when I first started, I never had a dream to be the best. I never had a dream to, you know, as you had mentioned, or other people do now. When did I know I wanted to teach tons of people? So as I go and look back with the experience, you know, that I've had, I don't think I ever had that in my mind. But what I did have in my mind, as just going way back to my youth, is always like seeing other people happy. And if I was able to be part of that success, or part of that pleasure, or part of that happiness, I just really enjoyed that, right? And so coming out of dental school, I had an affinity for the surgery thing, and I just felt like the intellect of being a surgeon was just so incredible. And I guess for me, the more that you know, the more that you value knowledge.
Yeah.
And I love speaking with knowledgeable people, or I love intellect, right? And so I felt like doing dentistry had to have a lot of intellect, but it's almost, for me, and in my opinion, doing surgery and bringing people back together, having a vision and taking them apart and putting them back together. There was something about that was just amazing. And my search for being able to do that was lengthy, but I understood it. And so as I was understanding it, my peers were watching me. They were like, how are you doing this? And I felt like what might have come easy to me, not easy like I didn't put in the repetition, but easy like where I understood it and I loved it, right? It was very easy for me to explain to them, like my philosophy, my strategy, and the things that set me up for success. And literally one night I had a dream. I call myself the Martin Luther King of dentistry. And it really happened. And I woke up the next morning and I was just like, why aren't I being more formal about how I teach people like me? Right. And I started writing, and literally 4 or 5 days later, I came up with this concept that till today is my number one hit, my number one song, my Mentoring One.
Yeah.
And other than updating cases in the course, not much has changed outside of that, other than, current medications that are out there and, the obvious life shifts, right, that are involved. But from the fundamentals of what I taught 19 years ago, much of it's the same. And the passion of not only being able to do that, but seeing the results in people and being able to inspire people. It is a gift for anyone. And I don't take it lightly. I am so fortunate to be able to do that. But even more than being fortunate, it's the joy of it. That's what keeps me there.
Yeah.
The joy of someone coming to me and saying, hey, Engel, you've really changed dentistry. You know that? It wasn't until a few years ago where I was able to say, you think so? Really? And now I feel, okay, 16,000 alumni, quarter of a million implants a year going in, you feel like maybe you made a dent. And I love it. I love it. As you age, you realize life's short, and to look back and to see, 20 years of help and what I've done to the industry, it makes me feel like I really donated. So it's good thing. Yeah.
Yeah. Now, typically, when you get into these types of classroom situations, it's typically not a GP teaching other GPs. Is that right?
Well, just for clarity, in other classes, not that I visit them a lot, but usually you have the oral surgeons and the specialists, GPs. And the reason for that is because we didn't learn this stuff in dental school. And not only did we not learn it in dental school, but to the credit of the surgeons, they go on for 2 to 4 to 6 more years, depending on what type of degree they're trying to achieve. And they intellectually have it, right? So it's kind of like teaching a 5-year-old how to ride a bike. The father or the mother knows how, right? So you got to give it that, drip theory to the kid and teach the kid. Whereas, and those guys, there's a lot of great guys and gals out there doing this that are specialists. But I think the advantage that I have is that I'm a GP. Yeah. And when someone can look at a screen or hear me speak from a GP to a GP, I think that it makes more sense to them, right? Like, wait, this guy did it. I think I can do it. And the great part of it is you can, you really can. It's just like losing weight or going to the gym and getting this physique that you want. It's not easy. And you wake up every day. Some days you don't want to do it. But that's the difference between the guys and gals who are on Channel 4 on Saturday playing golf and those who aren't, is the commitment to the sport. And I'm a workaholic. I am, but I love it.
Yeah, that's important. If you don't love what you do, I think other people can see that, and it's pretty transparent. And so it's I've in full disclosure, I've sat through 2 of your classes now, and I think I told you this. I'm not a dentist. Certainly, I'm a marketing guy, right? And the way that you are able to articulate yourself and just make things complex things just seems so simple. I mean, I'm like coming out of that thinking, man, I wonder if I could do this myself. Right. And I'm like, okay. And then I come back to reality, but you have that knack and you can tell that you love it. And you can tell that everybody in your class really, you want them to be successful, at the end of the day. So maybe you could tell me a little bit more about, you have different skill levels, obviously, that come to your classes. And, I think probably as an instructor, as I've done some courses as well, you can identify pretty quickly who's going to be, kind of top at the class and maybe who's going to need a little bit more help. How do you manage that? How do you get some of the people that you kind of think may need more help? How do you give them more attention, or, what's your strategy around that?
Well, I think that, first of all, thank you. I think that the mechanics of doing surgery and the mechanics of placing dental implants, it's not the most difficult thing in the world, but what is difficult is the management of everything else, right? Yeah. And so thank you for acknowledging that, what you've seen in my teaching. I think that, and we can get into this a little bit more, but I think that the full management of the patient is now, I think, what may be missing in a lot of relationships out there, the full management of a patient. I mean, which I'll come back to. But to answer the question about how do I teach where, there might be different intellect in the room, what I teach in Mentoring One is the fundamentals of the implant language. So, it's one of these things where it's algebra 1. And if you want to be a scientist or a doctor or an astronomer and, an engineer, or whatever it is that you want to become, you have to get through algebra 1. And algebra 1 can be taught to you by someone you really enjoy. That makes you want to go right and take algebra 2 in your next semester of college. And you want that instructor, and that instructor's courses are always full because they teach you, but they make it an experience for you where you're like, hey, I like that. A good restaurant versus a not such a good restaurant, right? So I think what I have maintained over my career is people enjoy it, right? So they come and I make it fun and I'm down to earth and I make it doable. And part of the talent that I have to work on constantly for me is if you brought in, a bag of balloons and there were 20 balloons and and you cut the bag open from the ceiling and all the balloons were starting to fall. Imagine that some fell quicker than others and you had to keep them all off the ground, right? So you'd be running back and forth. And your expertise in doing this would be, I know kind of almost like the order, and I know which one's going to fall quicker, and I know how fast I have to run back and forth. That's something that I think I've mastered, right? So if you take the balloon, the red balloon that's coming down really, really slow, that might be a slow learner. Where the purple balloon is almost hitting the ground, I got to run over there and kick it up to keep that person interested while I'm still entertaining the red balloon, if that makes sense. And I think I've been teaching this so long, Chris, that like I tell the audiences that come to me, I know how to do this. I mean, there's only so many times you could teach the quadratic equation before you know the quadratic equation. Right. So the way to keep the quadratic equation interesting in the room full of people that don't get it the same way is you humanize it, right? So you make it more about the classroom than the equation. You see? Yeah. And what's interesting, which would take me to my next part, and I know we don't have a ton of time, but when COVID started and nobody knew what this was, okay, so let's go back to March 2 years ago, and no one knew what was going on. People were calling me and saying, hey, will you do webinars? Will you do podcasts? Will you do, Zoom meetings? And just talk to them and just make sense of this time. And I did, and I said, guys, when we come back, the industry is going to be very, very different. And much like the rich get rich and the poor get poor, unfortunately, in this, what's happening with all of this, you have the dentists that are going to follow one track of practice, and then you have the dentists that are going to follow the other. And I think that there's a great divide right now. Yeah. And which gets me to the point that kind of connects them. I think that the thing that's most important above all is taking the time and making sure that you prime the relationship with your patient. With whatever it is that you want to do. And some business models don't allow for that, right? Yeah. So I take 20 minutes with every patient. There's a lot of business models that don't allow for that. And I think that ultimately you have to pick what kind of success you're going to have. Is it going to be a lot of success with 6 patients a day? Or is it going to be a lot of success with 36 patients a day? And you have to find that recipe. And that's kind of going back to the balloon thing. That's how I am as a speaker, as an educator. But it goes back to the passion too. I mean, I just love it. So thanks for bringing it up. Thanks for being in the classroom and acknowledging that. I like to inspire versus, just teach. So.
Yeah. You are like an analogy master. I don't know if you have a master course in that or not, but yours are like spot on. So
appreciate that.
I love the balloon analogy. I'm like, oh yeah, that makes sense. Right?
Yeah. Well, I think, even when I teach these people that are in what we call mentoring 1, the first class of the continuum, you get these doctors that are brilliant and you get these doctors that have great hand skills. When they come to my class, I'm like, guys, you have a handpiece spinning at 40,000 RPM. And you go in between teeth and you cut a little 1 millimeter box. That's talent, And so the difference is how can I make you understand my language if you barely understand the letters, right? So for instance, I'll ask somebody in the classroom, who in here speaks another language? And I'll call on someone and she'll say, I speak Korean. And I'll say, okay, could you teach me your whole language in 3 days? No way, right? So you'd have to break it down and have a strategy to how I would learn your language. Maybe start with conjugations or verb, whatever it is that you start with, right? And then ultimately over months and months and months and being immersed in it or moving to Korea as an example for a year, you get it. And that's the same thing with the implant thing. So to the analogy comment, so if I'm teaching you how to keep an implant straight between teeth, I'm going to use the analogy of a field goal post. Or if I teach you the analogy, if someone says to me, Dr. Engel, what does it feel like if you start drilling in bone and you drop in and you're above a nerve or under a sinus? And I say it's almost like driver's ed, right? Eventually you just realize when you're driving a car that certain things don't fear you as much. And so I've always taught with analogies, and they're fun. So thanks for
I think I'm kind of the same way, because it's almost kind of like when I do classes, I'm like, how can I make this easier for people? And that's the way it works.
Are you looking to grow your practice but are a little unclear on what the best way is? Let us help you out. We have over 13 years of experience in helping practices just like yours increase new patient growth. Just go to kickstartdental.com and sign up for a free strategy session where we will give you some great insights on how to take your practice to the next level.
But let me ask you, there's going to be a lot of dentists watching this and paying attention to it. And there's going to be a lot of them in different, some have probably done implants before, but, what's one piece of advice you'd give to somebody and maybe that, isn't doing implants now, wants to learn, and they're thinking about getting into that business? What do you recommend to them?
Yeah, it's a great question. I think ultimately, when, first of all, going back to the initial question you asked me in my initial beginnings, okay? I bought a very small 800 square foot office for $125,000. I came out of dental school with that, like everybody. I didn't have anybody financing me. I didn't have a relative that I was going into practice with. So I had to have this kind of vision board of what I wanted each year, right? And I never knew how good it would be or how big it would be, but I always knew I would be successful. Like, to what magnitude, I don't know. But I never feared that I would fail, regardless of what I was doing. And the reason for that is because I always knew that with complications in practice or with clinical failures in practice, right, that there's ways to bounce back. But the key is, for me, is always be kind to the person that you're with. Always be where your feet are, meaning make them feel like they're the most important thing that exists right now. And they are. And always be truthful. And I have found that combination has always made people around me comfortable with me.
Yeah.
Okay. And so the next thing for me was like your question was, well, what would you recommend for those people who are considering going into implant dentistry? I would recommend that you understand your limitations, and you need to be taught those, right? So when people come to my Mentoring 1 class, I always say, I am going to put you in the proverbial box, and you have to be disciplined. And if you're disciplined, you can grow and learn like I did, like the first few words of Korean, as the analogy I used earlier. And if you try to use more bigger words, you're going to embarrass yourself. In this case, you're going to get yourself in trouble, right? And you have to feel like, if this is what you want to get into, you have to be relentless to the commitment of the learn. Otherwise, honestly, just don't do it, because this is medicine. Oh, you're a doctor? I'm a doctor. What do you do? I'm a dentist. Oh, you're a dentist, not a doctor. No, I'm a doctor, right? And so over the years, our subset of medicine is, oh, you're the dentist, meaning like you didn't have to work as hard, or you're not quite as smart as an MD. The heck with that. Yes, we are, right? But the question is, how far do you need to advance in your own domain? So to answer your question, I would say always be committed to being better.
Yeah.
Understand that not everything that you do is going to be the way you want it. Okay. That's why they call it a practice, I always say, and not a perfect.
Not a perfect. I remember that.
You have to be, you have to be okay with knowing that you will fail. And sometimes a bigger fail, and sometimes a nominal fail, but you have to build, and you have to be able to get over that. And on the same respect, I would say, when you do really good things, be humble. Try to find that center point where, you have a few bad and you have a couple outstanding ones. for too long, and we don't dwell on the ones that weren't so good for too long. That we try to stay in the middle where we're more stable. And I think that's probably the best advice that I could give, and especially for the young doctors, like for me, who wears my heart on my sleeve. I mean, when I did cases, I know how to put it in its place now, right? And the thing that allows me to do that is my consciousness of knowing I did everything to the best of my ability, and I took on and do that. And if you work on being good, money will be there. Money will be there. Ask the local restaurant owner in your little town somewhere who has 12 seats. Restaurants always full with a line outside because the food's good. So be good, be honest, be kind, and everything else will follow.
Yeah. I think that's great advice. And, I also like how you run your institute, and that you mentioned M1 a couple of times. Now you have 4 different stages or levels of learning. Could you maybe just tell everybody how that works?
Sure. So we have 4 stages of learning. I never believed in having you have anyone sign up for a continuum. Like, you sign up and then I see you X amount of weekends over the year or what have you. Because of merely what you said earlier, which is, how do you handle people that learn differently?
Yeah.
And people do learn differently, right? So what I decided to do was, I decided that I was going to develop a curriculum that connected, but that the doctor, the attendee and or team would take it at the pace that they felt comfortable growing, right? Because in order to take Algebra 2, you have to be ready for that formula, right? So Mentoring 1 really is, I'm a little biased, but in my opinion, the best intro implant course in the world. I just really believe that, and I say that somewhat humbly. It really breaks down the basic fundamentals about how to be safe, how to build teeth, and how to be confident. Like, what I hear more than anything in the reviews I read is, I have the confidence that I didn't have, and he breaks it down to be totally doable. I want people to understand how the body works. I want them to understand how people heal. Just all of the basics, the anatomical considerations, right? That's Mentoring 1. Mentoring 2 goes into advanced cases like single anteriors, ridge splitting, sinus movement, internal sinus lifting, multiple implants, socket grafting, et cetera, et cetera. So it's more of a cosmetic surgical program, fix and repair. And then Mentoring 3 is a fully guided course, which is, not where we're going, it is where we are. Guided surgery workflow, all the way from the beginning to a printed temporary. That's for singles, multiples, and full arch staged. So it'd be like an overdenture, full arch deal. And then Mentoring 4, which I wrote about 5 years ago, is a full arch immediate load same day course. So we do a lot of surgery. I think we do about 7 or 8 arches in that class. Everybody does full arches. And so the growth rate, it really depends on you. And what's interesting is the alumni are so committed, and I think it's the style of learning that they love. I like to make it fun while they're learning, and I think we've done a pretty good job at it year after year. It's got more demand for the courses, and they sell out quicker. And I have a great time doing it. So that's it. 1, 2, 3, 4. It's kind of how it goes. And it's been an amazing run.
Yeah, it's incredible to me as being kind of like the, non-doctor in the room when I go to these, but that, it's not just in class learning. I mean, there's a lot of lecture, and then there's, in M1 anyway, you get out the tools to kind of practice before you do anything. Sure. And then the final day of the M1, I believe, is, you've got these students actually working on live patients. And to me, that's incredible. In a 3-day course, you can go from, kind of learning to practicing on, some clay models or whatever they are to live surgery. Tell us a little bit about that process, and how did you develop that? And in the beginning, I definitely want to know this.
Yeah.
Like your first or second class, you're going from like working on models to live people, where you're like, ooh, is this a good idea?
Yeah.
Tell us about that.
It's like the 20-year marriage, right? It's going back and say, hey, where was the best place you traveled to, and what was like your defining moments that you guys remember as a couple. When I started writing these courses, I felt like just early on, like, what is missing in this education? And I think it was a few things. One, at the time, there weren't really any GPs teaching this stuff.
Yeah.
In fact, it was frowned upon even for us to do them, let alone teach them. So that was one hurdle we were facing. The other thing was there was no private organization in this country doing courses where doctors, mainly GPs, right, outside of residencies, could go and learn how to do dental implants and learn on patients. And so my formula was, the way that I became a good practitioner out of school, and then year after year after year, developing quicker, better hand skills, is by working on people, right? Not working on plastic models where if you kind of screw it up, you just get the next one and you drill again and you try to straighten out your prep or whatever. So you had to be really mindful that there was a human connected to that. You had to go for excellence, and it made you really think about what you were doing. You don't have a lot of second chances, right, on a live human being. Right. So my model was, let's get real people like we had in dental school, where we can't mess up, where we have to think things out. What if they bleed? What if they move? What if they get angry? What if we can't find something that we're looking for? What if we can't drill deep enough? All of these things with a human connected to it, which made you think, critically. And I thought it was a great concept. And I started this concept in 2004. And I was using an implant. I was working with, at the time, Henry Schein. And we were using an implant called Camlog. And we had 4 straight courses sold out. And no one really even knew me at the time. And they were sold out because we had live patients and no one had ever heard of this. And the problem that came from that was people from around the country were calling and saying, hey, I want to go. I want to go. I want to go. They were calling from Canada. They were calling from all over America. And we couldn't take that because at the time I was in California, and California is a closed licensure, meaning, there's no reciprocity with CE. Like, you can't come in from Chicago and work on a live human. So I got together with the people at Shine, and we were like, well, Todd, what do you think would blow this up? And I said, well, I've got to go to different states. And so I would find young dentists like myself at the time, and I would help them in their implant journey. And I would say, okay, now can we use your office? Can we come here 3 times a year? And here's the deal. We'll donate the stuff to you, to the public, and et cetera, et cetera. And you can, learn how to speak and teach and do. And they loved it. And before I knew it, I had 13 locations. I had 13 locations, 12 in the US, and I was also in Toronto. So I was doing 3 classes a year at each location. That's 39 weekends. And then I was doing 1 weekend extra because living in California, I did a 4th. So I was doing 40 weekends a year. And I mean, we all know that I think there's 7 federal acknowledged holidays, right? So I mean, there's not many more weekends left, besides, outside of Christmas and all the holidays, right? Easter and everything. And so I worked it, man. I hustled. And at about 7 or 8 years, I was like, I'm done with this traveling stuff. So I started to limit the amount of places that I would go. And ultimately, I moved to North Carolina because North Carolina has a law that allows you to come in on a reciprocal that lets you work on patients. And so that's how that came. And I mean, don't get me wrong. I think the classes are phenomenal. And I think I'm a fun speaker. I mean, if I was a student in the class, I'd want someone with my vibe, meaning like the excitement of what I'm doing and loving people and having fun and telling borderline, funky, nasty jokes. You've heard them, Chris. Just real life, right? And wow, the speaker's cool. This is fun.
Yeah. It's not like somebody's talking down to you, in my opinion. Anyway, you guys are all on kind of the same level. It's just you've done it 1,000 million times, right?
And the thing is I don't come off that way. They know that. I go, look, I'll just tell you, I place 30,000 implants. I do 155 arches a year. Forget that now. The only reason I've told you is because I have the experience. But I think in the entire course, I would bet that I do not show more than 5 of my cases. not more than 5. And I think I only show 1 on day 1, maybe 2. But it's not about me. But to answer where you're going, day 3 makes it different, right? So yeah, I would love to be in a 2-day lecture with someone like me who was fun and related and all this, and didn't want to show up everybody with my knowledge, intellect, and my beautiful cases, right? Be real and humble. Day 3 is really the differentiator. So we donate to the public. And the thing about donating to the public is it's not like we ever see them again. Get in line, get a free implant, and then see you around.
Yeah.
These are all either my patients that we donate to, or doctors in the area that say, hey, if you need an implant, you can't afford one with me, go to Engel. He'll get this done for you, and I know he'll send you back. And so for me to look back on it, it's probably like the person who invented liquid paper. You go and you look back and you go, I don't remember how I did that, but damn, that was a really good idea. And it's carrying through these generations, right? And I look back and I'm honored, and I'm honored. I'm just honored that I hit on something and it made something, and all these people were able to be rewarded from it. I mean, I've had an amazing run with amazing doctors who do amazing work, and it's just been, I couldn't have planned this out if I tried.
Yeah, well, you did I don't think anybody can plan it out, but I think, I'm all about being able to adjust, adapt, and overcome in life.
Yeah.
And it sounds to me like, everybody has a story, right? But man, for you to go from, being a drummer to maybe I want to be a doctor to, leading the charge in implant dentistry for GPs, it's incredible. And I think a lot of people watching this are going to be, definitely charged up about, I think you give a certain amount of energy to people that need it. And that's inspiring for sure. So
I appreciate that.
Yeah, absolutely. We're going to start wrapping it up here,
Sure.
But, where, people are probably watching this and they want to learn more. What's the best way to find out more information about your courses and how all that works?
Yeah. I appreciate that, Chris. If they don't know, if they've not heard of it or seen it, it's me, it's Engel, Engel, institute.com. And it's got probably about 20-25 classes on there, dates. They kind of fill up a little quick. I think some of them at the beginning of the year are full. And we max out at somewhere around 15 to 20. And the reason for that is we want to keep it personal. I don't want to rent out the big convention hall at some hotel and never see your eyes or never know who you are, or, have you in a line of people. I want to keep it intimate and small. And so it's engelinstitute.com. I love communicating with a lot of the people that have come through my journey. And I always tell people, don't call the office, don't, email. It's just everything gets so caught up in backlogged. The best way to do it is let's talk on Instagram, right? Mm-hmm. Todd Engel, DDS.com, TODDENGELD, DDS.com. And it's quick and easy, right? It's on and off, and it's great. Speaking of social media, I know you're not asking, but I'm going to tell. I had the opportunity of meeting several social media people, and I don't even like to call them social media people. Or do I like to call them marketing people? I like to call them promotional relationships or marriages. And kudos to you, Chris. To capture the heart of the Engel clan, to be part of what we're doing, which you are. It takes a lot, because we put a lot of people through the strainer to protect our brand. And I just want to give you a thank you, and anyone who is listening, I want them to know that they should definitely follow and subscribe. There's a lot of learning pearls. Take it a step further and see how we can help you, for sure. Great dude, great business, great concept, great model, for sure. And you got my stamp for that one.
Awesome. Thank you so much.
Just one more thing in the next 10 seconds or 20 seconds here, I have found that, hearing no or being defeated in anything, we always have, methods and routes that we can bounce back at. And I always tell my audiences, I've heard the word no so many times, going back to 2009 when I told big CEOs that this was going to work, and some of them didn't believe it. And it's hard when you walk away with your tail between your legs, but you have to believe. You have to believe, and you have to stick to your passion. and you have to fight on.
Yeah.
And that's been the mojo for me, man. Fight on.
That's a great story. And, there's so much we haven't covered. And I have got this this whole list of questions, and I got like 4 of them just because it's been such great content. But I definitely would love you to come back and do another session maybe in a couple of months, because I know this is a big topic. I get asked about implants all the time on the marketing side of the business. Like, hey man, I really want to do implants, but I don't really know where to get started. And I think people see, they're taught in profit margins, right? And implants have, the business side of it does make a lot of sense. There's once you get good at it, I think it's a fairly easy thing to do in some cases, and the profit margins are there, and there's definitely a business reason to do it as well. So on the marketing side of it, I get asked about it all the time. So I know that this will be good content. I'd definitely like to do a follow-up with you if you're available.
Sure, absolutely. I think before I let you go, in terms of success for the doctors out there, I think the key is to really, of course, to know which cases are good, but to also know which cases aren't good. And I think if you pick the right cases, which we go through in mentoring one quite a bit, if you pick the right cases, you can really set up your averages quite high for success. And then it can be quite profitable. And that's very fair. I think everyone should make money.
Yeah. You bring up a great point. I was just about ready to wrap up, but I remember in your last class that I was in, you talk about this, like, it's okay to say no, because there are some cases that it's not worth it to mess with. Because if you make a crucial mistake, that's something that's going to be with you for a long time. In the beginning, take on the easy stuff. Would you, is that the best advice that you would give to somebody?
That's the single most thing for me in my career right now. I know how to place implants. I know how to do arches of implants. For me, it's now about, can I meet this person's needs?
Yeah.
And keep in mind that the higher the treatment plan, the more expensive the treatment plan, the higher the chance that this person is a moving target with what they want and need, right? So for sure.
Yeah. Well, great. Thanks, Dr. Engel, so much for being with us. We'll definitely follow up with you in a couple of months to see how you're doing. But everybody, thanks so much for listening in today. If you like today's episode, please hit that subscribe button. We release a new episode like this every week to help busy professionals like you to get the most out of your marketing strategy and really business strategy. So thanks again, and we'll see you on the next episode.
Thanks for joining us this week on the Dental Marketing Podcast. Make sure to visit our website, www.kickstartdental.com/podcast, where you can subscribe to the show in iTunes, Spotify, or via RSS, so you'll never miss a show. While you're at it, if you found value in the show, we'd appreciate a rating on iTunes. Or if you'd simply tell a friend about the show, that would help us out too. If you are ready to grow your practice, then you might want to schedule a free strategy session with us. Just go to kickstartdental.com and click the free strategy session button and give us 15 minutes of your time to change your practice forever. Be sure to tune in next week for our next episode. And thanks for listening to the Dental Marketing Podcast by Kickstart Dental Marketing, where dentists go to win online.